My name is Greg, and I'm going to be moderating today's session, as well as providing some of the research context. And we'll get started. So today's webinar has attendees from all across the country and in a variety of institutional roles. We're hoping to provide a high-level review of the data security threat landscape as it pertains to research institutions, both public and private universities, as well as academic medical centers or other health systems who receive federal funding, and talk about some of the consequences of both non-compliance with federal rules, but also just generally of having a cyber incident take place at your institution. We're also hoping today's program will equip institutional leaders and administrators from differing perspectives, researchers themselves, research leaders, research administrators, as well as non-research IT and information security personnel. We hope attendees will walk away with some knowledge of compliance areas that have data security implications at their institution. Also coming away from today's program, we're hoping that attendees will be able to have conversations with their information security partners within organizations about unique requirements of research programs to promote a cross-institutional dialogue and a perspective to really identify needs and set strategy going forward. Finally, we're hoping to encourage attendees and our partners across the industry to assess institutional compliance programs and areas of risk that will strengthen your own security environment. Like I mentioned, my name is Greg. I'm a manager at Huron in our Research Enterprise Solutions business. I generally focus on research administration, assessment, transformation, and operations for clients, but I'm also a part of a team internally who's really been focused for about 2 years on foreign influence in research. Notably, in the fall, we conducted an enterprise-wide compliance assessment focused on international activity. And one of the key outcomes of that project was a research information security roadmap. And my colleagues, Merritt and Matt, who are joining me today, helped with that project. So Merritt and Matt, can you please introduce yourselves? Matt, you can go first.
Yeah, good afternoon, everyone. Thank you for joining today. My name is Matt Tryniecki. I'm a manager in Huron strategy and operations practice alongside Merritt, with a particular focus in IT strategy and more pointedly in information security, privacy, and compliance in higher education specifically. So I've been in this practice for close to 5 years, serving predominantly higher ed clients. Prior to that, I have a background as an IT auditor with a Big Four firm, so I've had sort of that external sort of assessor's type view for a lot of these security and privacy areas. I would say in the past couple of years, we have noticed just sort of an uptick in the visibility and the importance placed on information security, particularly in research. I think we've done a lot more work in recent years in this space. So we'll talk about four of the key areas in this space. I think in particular, Merritt and I have done a lot of work in the NIST, sort of everything that falls under the umbrella of CUI, so NIST 800-171 and CMMC. And we've worked with several institutions to help them understand their gaps against those standards and sort of lay a roadmap for moving forward and trying to determine what are the people needs, the process needs, the policy needs, the technology needs to sort of meet these demands and meet this ever-growing area. So that's sort of one area where we've had a little bit of specific experience in. That's a quick introduction for me. I'll hand it off to Merritt.
And welcome, everybody. We appreciate you joining us today to have these very important discussions. My name is Merritt Neale. I'm a senior director with Huron. I sit within our strategy and operations group supporting our education clients. I have over 25 years of experience, all in information technology, and much of that time has been spent in security and risk assurance areas, supporting clients. I've been with Huron coming up on 8 years now, and I sit in the same practice and provide the same services as Matt did, with that emphasis on security, privacy, and compliance. I think one of the things we're hoping to hit on today are some of those basics that we see clients missing, some of those foundational practices or controls, and provide you with some food for thought on that front. And then, I feel we really are in a unique position. We have the good fortune to meet with CIOs, CISOs, chief privacy officers, compliance professionals, and others across higher education. So with that good fortune, hopefully we can share some information with you. And if you have questions and answers, I think we've got a mechanism for that to occur. Back to you, Greg.
Thanks, Merritt. Thanks, Matt. So we're also going to use the poll function today to ask you a couple of questions. We hosted a compliance webinar last week and used the same function. One of the surprising, not surprising rather, but interesting and salient for today's topic result of those questions last week were the responses to this question, where reported that one of their biggest challenges related to foreign influence in research was information security, closely behind research administration and conflict of interest and commitment procedures. Throughout the day, I'm hoping that we can talk through some of the reasons why that might be, and then make some of the connections for you all, probably a slightly different audience than last week, and help think strategically about how you can begin to address some of those gaps that are keeping some people up at night. Now I'm going to turn it over to Matt and Merritt to kind of walk us through some of the broader consequences of non-compliance.
Yeah, Merritt, I can go ahead and go first, and then you can jump in and add some context. We won't necessarily talk to all of these on this slide, but two that I want to highlight are the two at the bottom there, and that's violation of student and patient privacy and bad press and damage to institutional reputation. I kind of like the juxtaposition between these two because for student and patient privacy, those fall under sort of very clearly defined regulatory areas, HIPAA and FERPA. So it's reasonably straightforward to determine where you might be in compliance or out of compliance with these areas. When we're talking about bad press and damage to institutional reputation, this may be a little bit sort of less well-defined of an area where institutions may be wading into areas that may lead to these things. So I think the consequences of non-compliance, I think they fall sort of both into these sort of well-defined areas and not well-defined areas. And I think some of the best practices that we'll talk about today can help institutions sort of address these risks that fall across both of these categories.
The one area. Yeah, please. The one area I was going to talk about was national security. I know that's something near and dear to all of our hearts, and probably most of the attendees on this call aren't trying to safeguard missile blueprints or similar items that would compromise our national security. But there are things that I think a lot of professionals are starting to come to realize that areas are susceptible to attack that may not have been considered before. So, for example, I think we've seen some recent supply chain hacks, and this is clearly one that came up with our friends there at SolarWinds. And Matt's going to talk about that a little bit later, a very recent and widely felt example of a supply chain hack. We've also seen many of our research clients have definitely had increases in attacks, particularly those that are more social engineering based, such as phishing attacks or in many cases spear phishing attacks. We've also seen cybersecurity experts from the government. They're clearly bracing for other attacks, and they're really starting to focus on aspects of the supply chain, right? The coronavirus vaccine in particular, and what that distribution supply chain looks like. Just this morning, I was reading an article in the Washington Post that they indicated that state actors have actively attempted spear phishing attacks against companies in the coronavirus supply chain. And one in particular that we wouldn't probably typically think of was one that had to do involving the maintenance of the temperature for several of these vaccines that are out that have certain temperature requirements. So that's not something that we would typically think about. And when you think that far down on the supply chain, you wouldn't anticipate some of those vendors to have top security practices in place. So those can obviously be an area of concern. Also, the Cybersecurity and Infrastructure Security Agency, those that are doing government contracts or grant work, CISA, they've been actively monitoring threats and related to the coronavirus and specifically around response efforts. They have indicated that their initial focus was on organizations, pharmaceutical companies, research organization, and several other areas that would support that, but they haven't really specifically gone that far down the supply chain. So they're actively working to provide guidance to all organizations, not just those specifically at the top of the supply chain, to try to provide them with physical and technical guidance on how to manage these types of risk as they arise, or before they arise, hopefully.
Yeah.
Back to you, Greg.
So like Matt mentioned at the beginning, there are really 4 common compliance areas that we thought would be interesting to talk about all together, especially since Merritt and Matt have their sort of expertise and I have my focus. And I think that one of them is this concept of foreign influence at universities, medical centers, and research institutions. I think over the last 2 years, the federal government has begun to focus on foreign influence in research, but broadly, the stated goal has been, to Merritt's point, to secure the research enterprise. A lot of our compliance work at Huron with research administration clients has been to help manage inquiries and investigations at universities, as well as to help translate grant-making agency policies and requirements related to the disclosure of conflicts and outside affiliations and activities and foreign components in research programs at various times across the award lifecycle. Last week's webinar hosted my colleague Ann Pfeiffer, and she talked with counsel at Hogan Lovells, and they talked about the trajectory of federal regulations and policies and how even with a new administration in office, we anticipate that we'll continue to see activity not just related to grant-making agency policy around disclosures, but also specific flow downs from regulators that detail exactly how research data and fundamental research data even should be managed and stored from a functional and a technical perspective. DoD is one example that 2 years ago sort of focused at first on data and IP management control plans, requiring those to be established for a broader subset of research projects, while other agencies focused on conflict of interest. I think the recent GAO report that came out encouraged DoD to specifically take a look at some of its COI and COC policies where it's, other peers, peer federal agencies that made grants had that area pretty under wraps. I think that we can expect to see some of the non-DoD agencies closing the same gap for data security and information or intellectual property, rather, in the coming years.
Yeah, one thing I'd like to add to this also is that, and we use the word common, is the commonality in some of the controls and policies across each of these areas is pretty significant. Usually when we're working with clients, we'll start with one or more standards and build a crosswalk after we identify gaps in particular to help ensure that we're not reinventing the wheel as we build policy or standards or procedures. And if you think about some of the other common areas, each of these have some level of asset management requirement. Each of these areas have some level of control that are common across each of these requirements or frameworks. And you could certainly add to this list, including things like PCI, GLBA, obviously a plethora of other data areas that we have to be cognizant of and address as security and privacy professionals.
Yep, so we'll talk in a little bit more detail. I think we'll touch particularly on foreign influence and NIST 800-171 CMMC throughout this. 21 CFR Part 11 and HIPAA are 2 other areas. And as Merritt mentioned, there are other ones. For NIST 800-171 and DoD, I'm assuming most people on this call are relatively familiar with these standards, but that's as relates to controlled unclassified information in federal research contracts. So we'll talk in a little bit more detail on those on the next slide. So yeah, I'll sort of give a brief overview of 800-171 and CMMC and sort of how they're intertwined. So as I mentioned, these fall under the category of controlled unclassified information, or what's commonly referred to as CUI. CUI is a level of classification down from classified or highly classified information, which would be like national security information. It's also a level up from public information. So a lot of fundamental research sort of falls into that category of free and open information sharing that doesn't necessarily need safeguards around it. CUI isn't that highest level of sensitivity, but it is still relatively, it is still highly sensitive. And as such, there is laws and regulations which guide what information security practices and controls need to be in place around controlled unclassified information. As we mentioned, this comes into the research space through the Department of Defense and through NIST, and predominantly it's through federal research contracts or subcontracts, which have data which is classified in the contract language as CUI. There's been kind of an important development in this space in recent years that is really highlighting the importance of it. NIST 800-171 has historically been the standard that has been applied to CUI in federal research contracts. And for NIST 800-171, this is a set of 110 information security controls that are required. A system security plan is required. But there wasn't quite the enforcement level or the sort of teeth in enforcement that we're seeing for CMMC, because self-assessment and self-reporting of your compliance against that standard was okay. And also there was something called a plan of action and milestone, or a POEM, that was allowed as well. So if you did your self-assessment against NIST 800-171 and found, for example, we don't have multi-factor authentication in place, you were able to document that and say, we're going to target to have that in place in a year, for example. For CMMC, this is the Department of Defense's new program around CUI and research contracts. And this is requiring third-party attestation by an assessor that will be certified by the CMMC AB, which is the CMMC accrediting body. And attestation against all of these controls will be required before you're even allowed to bid on certain research contracts that have CUI. Now, the CMMC Level 3 standard, which will be applied to CUI, includes all 110 of the controls that fall under NIST 800-171. It also has an additional 20 controls, and there's also a process maturity scale that is associated with it. So whereas with NIST 800-171, it was more so checking yes or no, we have this control in place. With CMMC, there is a requirement to have the control in place, and there are also requirements around, is it documented? Is it repeatable? Are we assessing the control on an ongoing basis to improve it and make sure we're compliant? That facet was not in place with NIST 800-171. So certainly we're seeing the development of CMMC. That language is starting to be inserted into research contracts more frequently. And this third-party attestation requirement is definitely making this very, very much more real for research organizations.
Yeah, thank you. That takes us to our next, our first poll question. This is a two-part question. The first part is we're asking you as attendees of today's webinar to identify the institutional program with which you're aligned. So the choices here are information security, information privacy, or perhaps you're a part of a broader compliance program. And then also you could for sure be a part of another functional unit that's just interested or intersects with these topics and these programs. And then the second part of the question is we're asking you to rate your organization's research information security program maturity level. And Matt, maybe you want to walk us through some of these definitions.
Yeah, so I can sort of talk us through these. This is a scale you would see pretty commonly. CMMC has a similar scale to this. You would see this in a lot of IT, general IT or information security sort of best practices frameworks like ITIL, like the NIST cybersecurity framework. But it really goes from the bottom level of the scale where, processes, practices, policies, controls are not in place. So that would be none. And then sort of going up the scale, you have them in place, but they're inconsistent. That's at the initial level. At the emerging level, maybe they're in place, maybe they're consistently in place, but we don't have things consistently documented. And then going up through repeatable, managed, and optimizing, which would be the highest level. I think we see in research organizations, in higher education, typically we see, and I'm a little bit off here because we usually have this at a 0 to 5 scale, but because of the polling mechanism, we did 1 to 6. Typically we see people, we see organizations in higher ed at between what would be a 2 and a 3 on this scale. So certainly if you feel like you're falling into that range, don't feel like you're an outlier. That's pretty common.
Thank you. Yeah, I think we have some results coming in now. Looks like we've got a pretty broad swath of units here attending from institutions, which is great to see folks interested. And some varied results here on maturity. I think they are hovering in around that emerging level, Matt.
Yeah. So I think that's pretty in line with what we see. With regards to the first question, I do think that's interesting. Most of our participation is not from information security or from information privacy. One of the things we'll talk about is how to set up the organization to address these requirements, what governance structures need to be in place, and how that requires the expertise and the effort from research leadership, research administrators, campus leadership, in addition to the actual technical staff, the security staff, the privacy staff, who are heavily involved with implementing requirements from all of these areas that we're going to talk about. So I do think it's interesting that we don't necessarily have great representation from those two areas. I'm very happy to see the two of you from information security who are on the phone. But we'll talk a little bit about just best practice and guidance for collaboration across those groups and how really that important and necessary that is.
Yeah, I'd like to add on to that, Matt, as Matt had indicated, that usually we'll see folks between that level 2 and level 3 on that prior model. And that puts you at about a 1.5 maturity model. That's incredibly common in terms of what we typically see. And from those maturity ratings there, if you're at that level 4, you're effectively have that good hygiene that's expected in the CMMC level 3, where you are consistent, you're documented, and you're measured, as well as you've got some controls, all those controls in place. So that's very interesting findings. Back to you, Greg.
Yep. So yeah, I think with that overview, I wanted to walk us through some of the recent sort of big headlines that we've seen over the last really 6 months, starting with in May of this year, really about 45 days, I would say, into the impact of the COVID-19 pandemic. We saw FBI and CISA come out with an alert to raise awareness about the threat to COVID-19 related virus and vaccine data. They sort of put out an alert that said that foreign cyber thieves were targeting pharmaceutical companies, health systems, and research institutions who are working on some of the early research to start to beat the pandemic. And then in August of 2020, the University of Utah paid almost $500,000 to cyber criminals after they were able to encrypt really what was just a tiny fraction of data before U of U detected the attack that temporarily disabled some servers there in the College of Social and Behavioral Science. And then in November, we saw a major health system in Vermont really brought to its knees for over a month. The National Guard was deployed. I think 10 cybersecurity personnel from the federal government worked on the ground with over 300 employees to clean 1,300 servers and 5,000 workstations to restore access to patient health records. This story made repeated New York Times and Wall Street Journal headlines. And in addition to that, the New York Times also reported that cyber actors were able to shut down clinical trials for COVID-19 and treatment studies, as well as cut off access to patient records at multiple U.S. health system facilities. Do you guys have anything else you want to add about these stories that just happened?
Yeah, I think one thing that's interesting, and I think we might have some other examples in a later segment, but it's interesting that I'm working on a client right now, large academic medical center, and visiting researchers tend to be a problem in some cases. One of the leads for research had indicated to us that they'll walk through certain labs and there'll be half a dozen new faces in each one, and that the controls aren't necessarily there to have adequate processes for having people come in and out of the labs. Things like after hours piggybacking, right? These are kind of threats that would happen in your own physical facilities. Those are the kind of things that we've heard many concerns from clients above and beyond these actual examples of where breaches or compromises have occurred.
Yeah. Yeah, like I mentioned at the top of our program, when we were talking about the compliance areas that we were hoping to talk about today, the federal focus on foreign influence really started in 2018 when NIH worked with FBI and DOJ to identify a lot of problematic conduct at institutions related to the presence of undue foreign influence. And then I think when you couple that with these increasing instances of cyber attacks at universities and academic medical centers, as well as sort of this COVID-19 and the corresponding research initiatives that are happening, you can see there's a real trending need, I think, across the industry to tighten information security gaps, especially as it relates to research. And I think Matt will talk a little bit later and in depth about this, but depending upon the type of institution that you're working at, whether it's a university that does a lot of export controlled or restricted DoD work, you've got some sensitive data either received or generated on campus. You've got patents and inventions, or just even sensitive student data that you need to keep private. That kind of an organization might have a set of programmatic needs that are different but equally as important as those of a major research hospital that has medical devices to secure on its networks and patient and personally identifiable data to store securely, as well as virus and vaccine research results that you want to keep safe. So I think the message here is that depending on the focus of your institution strategically, whether it's students or patients or research, data security controls, depending on that focus, might need to catch up a little bit.
Yeah, and Greg, one thing just to highlight here, I think we have maybe 8 or 10 different areas listed out here. There's another 8 or 10 that probably aren't on the slide that could apply. And so when we think about the whole landscape of information compliance and all of the different areas and laws and regulations that could be applicable, it can be extremely intimidating. And if you go through and address every single one of those sort of in isolation and then go from one to the next one, it's going to be a lot of work. It's going to be a lot of reinventing the wheel. Different organizations on campus are going to have different needs. Some of them are maybe going to fall under a couple of these areas, but not other ones. But as Merritt mentioned earlier, there are some sort of baseline best cyber hygiene practices, like having an asset inventory, like having this really strong role-based access control model, like basic network and infrastructure security, and plenty of other things that fall under this, that really serve all of these areas and can help progress with compliance against all of these areas. So, like you mentioned, the crosswalk, we think it's really important to take sort of a cross-organizational, cross-institutional view, understand where the commonalities are between all of these areas so that you're not duplicating work and you're not reinventing the wheel from place to place, and you're getting that sort of baseline set of controls in place. And then for a particular organizational area or a particular compliance area, understanding what are the specific things, the specific regulations or controls that we need for this area that we need to address individually.
Totally. Oops. And then I think we have a couple more examples here to talk about. Merritt, do you want to kick us off and talk about what's happening this week with MD Anderson?
Yeah, MD Anderson's a saga that just continues. And if you're not familiar with it, here's just a quick snapshot that there was the loss of a laptop and 2 thumb drives going back into the 2012, 2013 timeframe. And there was concern over, were they encrypted? Weren't they encrypted? And after investigations had gone through a number of various conclusions. But effectively, as you know, or you may not be familiar with the fact that the HIPAA security rule requires encryption, the HIPAA privacy rule requires disclosure, right? And the HIPAA security rule has a laundry list of other requirements. The MD Anderson did have a tool for encrypting, but in this case, for the devices that were lost, they were not implemented, and this was something that the judge felt was shocking. MD Anderson definitely had encryption policies early on, but early on they didn't have those standards. But prior to that loss, they had defined the standards and rolled out a tool. MD Anderson, as part of their research, had argued that the PHI involved was for research only, so therefore they may have been afforded some exclusions as a result of how that data was being treated. So this saga comes to another chapter. Just 12 days ago, the Fifth Circuit Court of Appeals found that the prior findings were arbitrary, capricious, and contrary to the law. And there were 4 primary reasons, but I'm going to kind of focus on 2, which I've already mentioned. The first one was the encryption rule. And really, this comes down to semantics. And anybody on this call with any level of exposure to compliance requirements will appreciate this. Effectively, the court found that the encryption rule, that MD Anderson had provided the mechanism for encryption, but they did not provide the guidance that they had to have everything encrypted. So once again, MD Anderson had the mechanism, but they didn't necessarily have to encrypt everything. It was really more the responsibility of the employee. And the tool, it's called IronKey. It was deployed by the organization. It was provided to employees, but the employee had failed to install that software. So the judge in the courts felt that MD Anderson was technically in compliance. The employee was at fault for not following the policy. I want to repeat that. The employee was at fault for not following the policy. And, I think anybody that's been in this business for any period of time knows that HIPAA has been around since 1996. These regulations haven't changed significantly in terms of the actual rules themselves. So it's kind of amazing that a court would find that the mechanism was there and it was up to the employee to implement that. And the second thing that I thought that kind of struck me, and one of the reasons, was the disclosure rule, that HHS, as they defined disclosure, was really around release and divulging information outside of the entity. And the court described each verb that was used that implied affirmative action of disclosure and did not include a passive loss of information. So the loss of information wasn't specifically covered under the rule. It was that, which is obviously contrary to, I think, what we all believe as security professionals. So I think we might be looking at another chapter there. One other component is that MD Anderson was subjected to the highest fine of IOCR in terms of a violation. And the courts argued that there was no jurisprudence, no established court fines that had exceeded the statutory caps of 1.1 million. And this is something that Anderson agreed, that there was no statutory. The statutory recommendations have been too high by the courts previously. So that's just at a high level. Very interesting. I don't think that saga is done. I think that's something that we'll continue to hear about. And I think the findings are very much contrary to the intent and the principles of the HIPAA security rule and HIPAA privacy rules.
Yeah, thanks, Merritt. And then the middle point, I've talked a lot about foreign influence already, but right down the street from MD Anderson, which is in fact one of the first institutions hit with some DOJ investigations related to foreign influence that resulted in some faculty terminations. Down the street from there, in July, the Chinese consulate was closed by the State Department, and the FBI had claimed that part of the rationale was that that consulate was a hub of spying activities related to the transfer of medical research and sensitive data to China, and they uncovered over 50 researchers linked to that consulate that were participating in a foreign talent program. But some fun stuff happening in Houston in this space. I don't know if you want to talk a little bit about SolarWinds, Matt.
Yeah, I'll touch on this one quickly. I'm sure most people are familiar with this. It's been all over the news lately. And this didn't necessarily affect one research organization in particular, but it did affect 18,000 public and private sector entities. So certainly reasonable to assume it's affected some research organizations or organizations to which research works are part of the supply chain. And, I think this one illustrated that really, as we've seen several times, nobody, no matter their size or prestige, is safe from these kinds of attacks. So some of the groups that were breached included the Department of Justice. I think there was 10 government organizations or federal organizations total, but 2 that stood out were the Department of Justice and the Department of Energy. which handles the United States nuclear arsenal, also Intel, Microsoft, and Cisco. So some absolute tech giants who you would expect to be really mature in terms of their information security practices. A couple things to highlight about this. This wasn't sort of a traditional hack or a traditional breach. I think most times when people think of a cybersecurity breach, you think of a perimeter around the organization, whether physical or digital, like a firewall, and you think of somebody trying to sort of poke holes in that perimeter and find a hole and sort of find a way through. This was like somebody sort of just came in, like somebody walked in through the outer wall with the package and had something in there. So actually, the hackers compromised SolarWinds' build process. They inserted themselves into SolarWinds' product code, which was then sent out to all 18,000 customers of this product. So actually, a really sort of brilliant and sophisticated way of doing this. It really highlights the sophistication of all of the threat actors out there. So really sort of maybe non-traditional breach there. A couple other things to highlight. One, this was identified through training and awareness ultimately. So for 8 months, this went unidentified. And that's actually one of the biggest challenges with this breach, is that really nobody knows the full scale of it. The hackers could have had access to systems for all of these organizations that were breached for a really long time. And it's really hard to sort of retrace their steps. And I go back and identify and look at sort of the tape or the log and try and figure out what exactly was compromised and how much and when, because it was 8 months. But as I was mentioning with training and awareness, this was identified because somebody got, I'm sure many of us have used Duo or other multi-factor authentication tools. Somebody got a multi-factor auth request and they hadn't initiated it, and they reported it because they had received training that that's something to look out for, and then that's how it was identified. So training and awareness, maybe not sort of the coolest and most sophisticated part of information security that people think of, but ultimately very important, and it's what led to the identification of this particular breach.
Yeah, thank you. If you want to just quickly circle back to the idea of what role, organizational structures play in data security, Matt, I think that would be really good.
Yeah, absolutely. So we're thinking about the research organization itself as a standalone organization, often a part of a broader health system or a broader college or university. Research organizations, depending on their size, don't always have a cadre of information security professionals sitting around who can be tapped to help design and implement and monitor control programs, whether it's for foreign influence, whether it's for HIPAA, whether it's for CUI, whether it's for any area. So in an ideal world, in many of the larger research organizations, there is a dedicated research information security officer, or a chief, or rising to the executive level, a chief information security officer. And this is somebody that is part of IT, but can also interface with research leadership, can interface with the PIs and the researchers in their departments to understand what their sort of specific research and operational needs are, and what security controls and solutions that are feasible and aren't going to be sort of too disruptive to the mission of the organization can be implemented. So that's in an ideal world, is that position exists. But as I mentioned, many research organizations, I would even venture to say most research organizations, don't have that dedicated position. And so the responsibility for that, and we're flipping the slides.
Sorry about that.
It's okay. The responsibility for that falls to a combination of maybe people who are IT positions or who are part-time IT. Maybe it's the research administrators, maybe it's leadership, whoever it may be. So it's a combination of people who aren't necessarily information security dedicated, who are trying to drive compliance for these areas.
Sorry, Matt, I think something was laying on my keyboard.
No worries, no problem. We're back up. So this ties into sort of the next, our next little bit of content, which is priorities. And so, there's, I think, maybe different, but I would venture to say not competing priorities for the research organization and the institution as a whole. So the research organization is thinking about, how do we meet our sponsors? They're thinking about, how do we conduct great groundbreaking research? How do we fulfill our mission? how do we meet our sponsors' demands? And probably the closest tie into that is looking at the research data specifically and the specific regulations like around foreign influence, like around export controls, like around CUI. But it's very much under that research data lens. When you're looking at the institution as a whole, it's not necessarily a research focus from the onset. It's patient health data, it's PII, it's student data, it's financial data. Ultimately, I think everybody sort of has these common goals of operating successfully, of achieving our strategy, of achieving our mission, and there's sort of a baseline set of things that need to be done in collaboration between the research organization and between the broader organization that are going to drive progress against these goals. Merritt, you are on mute.
Sorry, hopefully that works. Yeah, we're all here. We all have jobs for one reason, and that's data. That keeps things moving in higher education and across all industries. I think one piece of work that we've been doing quite a bit is cybersecurity framework benchmarking. If you're familiar with the NIST cybersecurity framework, I kind of wanted to outline one of the real hard and fast dependencies here around data governance is if you look at the cybersecurity framework, the first core is identify. And if you look at those first four subcategories, they are asset management. You need to have an asset inventory of your physical devices. You need to have a software inventory. You need to have data flows mapped. And you need to have classification and criticality of those systems and that data set. And those tend to be a hard and fast dependency, not only for achieving data governance, but then also for ensuring the technical availability and integrity, confidentiality of our data sets across the organization. I want to just step through a couple of these different areas that make up what we call our house of data or house built for research data. Really starting at the top, obviously, we're research and strategy driven organizations. We typically have some form of data governance, but that's usually where things become a bit weak. Then we all have all these main components that we look to provide guidance and best practices on managing it. From a security, strategy, privacy, compliance perspective, looking at something like master data management with that lens on, we can see areas such as having an attribute-based control model if we have attributes out on our data set. That also helps with key areas such as content management. The data quality, having standards, having people agree on what's CUI, what's proprietary, what might be considered intellectual property in an organization. Understanding that and having those business rules to help it manage it accordingly are absolutely critical. And then when we look at process integrity, obviously we're looking for systems that can support reliable decision support. Once again, the reason that we're all in business today. If we look at enterprise data integration, one of I think the key challenges, this all drives back to that data classification, is if we have a system of record and it's integrated with other systems, if we have an access control model, does that model follow to other systems, right? For example, if we have a data warehouse based on ERP data and student data, do those access control rights flow similarly to our data warehouse in terms of who has access to what? When we consider things like master data management, obviously data integrity, we need systems of record that retain appropriate access and monitoring controls. That drives back to those standards as well. Data security management, that's really why we're here today and discussing those implications. In terms of business intelligence and analytics, one thing that we have a lot of discussions with clients are around use cases. So for example, what's the acceptable use of data? Can we create or should we create data use agreements to help outline boundaries or what data should not be transferred to another individual or system? Is it okay for us to combine student data, student health records, the student meal plan data, and other identifiers to help support student success? Do we have the ability to do that? Do our students know we're using our data for that? Those are some of the ethical questions we have to ask. In terms of content management, we have so many large volumes of unstructured data across our academic organization, research, or healthcare environments. I mean, it's quite astounding, and I'm sure there's nobody surprised on the call today to agree with that. There's increased requirements we're seeing from clients to help discover this data. We're using discovery tools to go out and find PII for various use cases for clients. And then really there is a huge need to have governance around content management. It truly has become even more of a wild, wild west. If we think back to the simple days when we just had shared network drives or SMB drives, now we have OneDrive, we've got local drives, we still have those shared drives, we've got Box, we've got SharePoint, and we've got 30 other places that we can store data. So having the rules and the governance around that are absolutely critical. As I mentioned earlier too, the third-party data management, understand what your vendors are doing with your data, understand how they're managing that. You request something like a statement of their controls or some sort of attestation on the controls that they have in place. I have several clients right now that are heading down that path of trying to increase their awareness of their third-party vendor security management practices. So a lot of different movement around third-party vendors. And before I wrap this slide up, I would like to provide a tip. Texas has something called TAC 202, or it's the Texas Administrative Code. And it really has some pretty good recommendations around managing aspects of data governance, particularly as it pertains to data stewards and data custodians. And it's called TAC 202, and it's called Information Security Standards for Institutions of Higher Education. It's a very pragmatic approach, and it's a great place to start if you're a little bit earlier in the maturity curve on this. And I'll make sure we add that into our chat.
Great. So this is just an example of specifically an assessment of information security that we did at a research institution that was really in a hospital setting. When we first got there, this was specifically focused on foreign influence. We heard, oh, we don't do that much, international work, and everything's on the up and up. And our information security program for the hospital is really mature when we think about our patients and our clinicians and our administrators. But then when we cut beneath the surface a little bit and talked to all of the stakeholders on the research side at the Institute, the PIs and the research personnel and the administrators, we started to hear anecdotes that I think raised some eyebrows in the compliance office about the types of research that happens, so vaccine and virus research or pathogens and biometric data that's federally controlled or protected. And we heard, oh, well, we do travel internationally. We do grand rounds in different countries, and we attend international conferences, and we host, like Merritt said, visitors from all over the world who sit in on our research talks and in our lab meetings pretty frequently and get ID badges and laptops. And also, we have this approved cloud storage provider, but it doesn't really work for us. We just keep our stuff, on Google Cloud or, Google Drive rather, Dropbox. It's easier. So we kind of said, look, take a step back, develop a roadmap that identifies the who, the what, and the how. Think about the players, where data is stored, what kind of data it is, and who gets access to it, and how it might be managed in order to develop an optimized solution for research. And then here's just some of the gaps and risks, but I think we touched on a lot of them, Merritt and Matt, if you kind of want to just move to the next poll question.
That's perfect.
Yeah. One real quick to touch on would be BYOD and bring your own device policy. So we've had a lot of clients that we've worked with who have said, the policy is you can't bring your own device, but we have no way of enforcing it, and we actually don't know what's connected to our network. So one of the things to think about is having a control like a network access control in place, so you can actually stop somebody from bringing their own iPhone or their own Mac or whatever and connecting to your network. But I agree, Greg. I think we've covered most of these in some capacity.
So our second poll question is, has your organization initiated a focused information security, privacy, or compliance self-assessment in the last 24 months? So the options here are yes, no, or maybe it's a part of your strategic goals for 2021. Just wait a second here for some of these results to come in.
And this could be, just to sort of comment on this, this could be for a specific area. So it could be, we benchmarked against NIST 800-171, we benchmarked against forest foreign practice, foreign influence best practices, or just sort of a broader information security program, using a best practices, a general best practices framework that isn't necessarily tied to one specific regulatory area.
And as consultants, of course, we like to have our clients come to us to assist them with assessments, but this is always a really good place to start. Hopefully a little bit lower pressure, a little lower visibility across the organization. It really gives you an opportunity to do a 360 to understand what's going on, where those gaps are, and how to set the priorities, as Greg had mentioned, on that roadmap going forward.
Looks like we have some results here. Okay. Looks like about 50% of you have initiated some kind of self-assessment. And some of you have it sort of on the roadmap for 2021 in some capacity, and then some of you haven't. I think this is a pretty expected result.
Yeah, I would say every annual or every 2 years is what we pretty commonly see. One thing we try to work with our clients on is how do you make it easier to do it on a recurring basis. So do maybe a really sort of strong, detailed assessment the first time around, and then figure out how do we go back and sort of refresh this in future years, maybe so it's not as comprehensive or as labor intensive of a process as it was the previous time.
Totally. And then our third poll question here is, are the results of self-assessments shared with organizational leadership as a part of a broader risk management strategy? I think that depending on the unit that you're sort of conducting a self-assessment in, you might just keep it sort of within your own shop, or you might be mandated to share it up with leadership. So the results here, or the options here for the poll, are that you do share them as a part of a broader enterprise risk management effort, or no, you kind of leverage those at the unit level, or the third option is that you do not conduct self-assessments.
Yeah, I think a lot of organizations we talk to, we ask about their enterprise risk management program and how do they manage IT risks, non-IT risks, and a lot of what we hear is on spreadsheets. And there are tools out there, there is software out there that can help manage this, but very commonly it isn't done maybe in a coordinated manner across organizations. Merritt, I know this is an area you looked into a little bit recently. If you want to comment on that at all in terms of enterprise risk management.
Yeah, I mean, we have multiple clients we're working with right now, particularly around IT. But I think what we often find, particularly in healthcare, academic medical centers, is that risk is not really an enterprise-wide view. Patient safety is top of mind in an academic medical center. Student attrition is top of mind in an academic setting. But really, I think one of the areas we're working with clients is to help raise that level of visibility and awareness. That back to the title of our session here, is that this is not just an IT problem, right? These are business decisions that have to be made. Everybody on this call could fix every problem. There's just two things missing: time and money, right? So I think those are some of the things that folks need to consider as they take these back to their organizations.
I think we have some results coming in here.
Okay. That's encouraging to see that we have so many organizations that are looking at across the enterprise. That's a little bit on the surprising, but very happy to see that. Usually we see a much more narrowly focused risk assessment approach.
Great, yeah. I think that we've talked a lot today about sort of this organizational approach and coordinating across units, really just setting a path forward, beginning to drive some change, and leveraging your investments along the way as you sort of follow the path that is the outcome of your assessment. But I think to wrap up here, Merritt is going to walk us through some key takeaways, and maybe we'll have time for one question or two if folks are able to stay for a minute or two after the hour.
Yeah, I think some of the major things that we're hoping that you'll take away from today, I think collaboration and coordination is key. As Ed mentioned, reinventing the wheel is a very painful process. We see clients spend a lot of time rewriting policy or duplicating policy where it really doesn't need to happen. Strategically, we see a lot of organizations moving to a model where areas such as security, privacy, and audit may fall under one umbrella. There's a number of organizations that are setting that precedence out today, and that drives back to just a more focused risk management approach and a high degree of coordination and collaboration. Understanding that broader organizational context, as I just mentioned earlier, it's important that you look across the enterprise because risk isn't just centered on any one particular area. Ownership, that really isn't cross-enterprise ownership or degree of ownership in terms of managing and executing, identifying risk. But then it's got to be, you have to also have very clear guidance on who has ownership, policy, procedure, who's responsible for ensuring that it's enforced, right? All big challenges that I think our client organizations deal with. And then change management. The concept of academic freedom in most of these circles is pretty prevalent. And there is a need to balance academic freedom and other kind of business or administrative requirements with the realities of what we're facing today, right? Threats from nation actors. We've got sabotage on a mass scale, infiltration of critical tools are in our networks today, helping us monitor and manage risk. So I think hopefully those are some of the major items you take away. Some of this can apply across the enterprise, but we are focused in that research space and we see these needs on a daily basis.
Great, thank you.
What I'd like to do is, I'd like to wrap that up. Let's see, Q&A. Do we have any questions and answers in the pipeline? I know we only have a couple of minutes here. I know we had, let's see here. I think we might actually be pressing here for time. One thing that I want to provide everybody some insight into, this Thursday, the 28th, from 1 to 2 p.m., we've been partnering over the course of 2020 and 2021 with EDUCAUSE. And we have a webinar this Thursday, as I mentioned, 1 to 2 p.m. Eastern, and it's titled The Rise of the Chief Privacy Officer. This dovetails really nicely into a couple of areas that we've been focused on over last year and into this year in terms of bringing together these areas of security, privacy, and compliance, trying to raise the level of awareness, having some really good dialogue with chief privacy officers and chief information security officers across the country, and just working to share those details out. So if you can join that, we'll make sure that information gets out as well.
Yeah, thanks, Merritt. And thanks everyone for attending today. Like I said, we'll be sharing a link to the recording of this session, and we'll follow up directly with those details as well afterwards.
Thank you, everyone. We appreciate you joining us, and we look forward to hopefully having some conversations with you in the future.